So we received the first set of resampling results, and they are negative, which is reassuring. However, in accordance with Health Canada's guidance for issuing and rescinding boil water advisories, 2 sets of negative samples are required 24 hours apart to rescind the advisory. In consultation with the Office of Drinking Water, and I'm very pleased to be joined by my colleague Kim Phillip here today, Manitoba Health, Healthy Living and Seniors, and the City of Winnipeg, it has been determined that we will continue the boil water advisory until the second set of samples are available tomorrow afternoon. This precautionary decision is consistent with our national guidelines, and at that time, rescinding the boil water advisory would be considered depending on the results. So all City of Winnipeg residents should continue to bring their tap water to a rolling boil for at least 1 minute before it's used for drinking and ice making, beverage preparation, food preparation, and brushing their teeth.
In October 2013, during the scare that time, a second set of tests wasn't required. What's different about this case?
Well, this is a different situation, and the circumstances are different, so we're approaching it differently.
So we recognize the inconvenience that extending the boil water advisory causes for the citizens of our health region, but out of an abundance of caution, we do believe that for the health and safety of our citizens, we do need to proceed in this manner. Our healthcare sites and services have activated their contingency plans. There's no service disruptions or canceled surgeries as a result of the boil water advisory. And we are not seeing any indicators of water-related illness.
As soon as a boil water advisory is issued, you need to have the second set of results if you're going to follow the boil water protocol.
Did you break the protocol then in 2013?
I make a decision based on consultation with the Office of Drinking Water, Manitoba Health, and the City of Winnipeg, and that was the decision that was made at the time.
Is there a theory as to if these are false positives, as some people say the indications are pointing to, what has caused the false positives?
I'm not able to speculate on that.
You did say, though, that the separate nature of the scattered clusters leads you to different hypotheses? What are
what, some of these questions can be directed. The City of Winnipeg is responsible for the investigation. And right now we don't have a lot of information to go with right now, so we're following the national guidelines and we're following the protocol. I'm not able to quantify the amount. I think if you're immunocompromised and there's E. coli present in the water, then you're at risk of becoming sick.
Do you agree that a 1 to 9 count is a low count as it was characterized yesterday? I realize 0 is the acceptable count, but as far as positive counts go, is 1 to 9 per 100 milliliters a low count?
We would characterize it as a low count.